This video will be discussing the sensitive topic of childhood sexual abuse, not in specific detail, but in terms of a study evaluating the effectiveness of an intervention to help adult survivors. Compassion-focused therapy, CFT, was developed to help people who experience high levels of shame and self-criticism, and has been found to be effective in reducing these difficult aspects of human suffering across a range of presenting problems. Adult survivors of childhood sexual abuse can experience very painful shame as well as self-hating self-criticism, which can also perpetuate ongoing symptoms of post-traumatic stress. However, there hasn't been a systematic investigation of CFT as an intervention for survivors of childhood sexual abuse until now. Let me tell you about our recent University of Queensland study, spearheaded by the talented and compassionate clinician-researcher Dr Lisa McLean, in which she and myself, along with Dr Matthew Bambling, carried out a preliminary investigation into group-based CFT for adult female survivors of childhood sexual abuse. So CFT has been found to be very helpful across survivors of interpersonal trauma more broadly. Researchers have evaluated CFT with survivors of sexual assault in adulthood, adults suffering from complex trauma and personality disorder, and adult female survivors of gender-based or intimate partner violence. Across these studies, researchers found that after completing CFT, participants had increased self-compassion and self-reassurance, reduced post-traumatic stress symptoms, depression, stress and anxiety, and decreased feelings of shame, guilt and inadequacy. On the basis of these encouraging results and the observation that there's a gap in the literature around evaluating CFT with survivors of childhood sexual abuse, Lisa decided to embark on her PhD, putting years of clinical experience and dedication to this area of practice into carrying out some real-world feasibility and limited efficacy research on the topic. I was lucky enough to be along for the ride, inspired by the wonderful Dr. Deborah Lee, and of course the work of Professor Paul Gilbert. Lisa developed and delivered her CFT SA program with 36 adult women who had experienced childhood sexual abuse and had ongoing symptoms and effects of this traumatic experience. The women were, on average, 41 years old, ranging from 18 to 65. The program itself was 12 two-hour weekly sessions with a 3-month post-treatment follow-up. Sessions included mindful attention, understanding compassion and the CFT framework, identifying fears, blocks and resistances, developing compassionate thinking, reasoning, feeling and behaviour, understanding shame and trauma, bringing compassion to shame and trauma, and maintaining compassion over time. 4 participants left the group prior to completing, but of the 32 participants who completed the group, we had very promising feedback and results. Lisa did a wonderful job, and CFT seemed to be an acceptable and valued approach by the participants. Some of the comments after the group were that participants found the group to be transformative, easy to understand concepts that could be practically applied, and excellent course, beautiful, made me feel great and accepted. And participants reported significant changes to psychological well-being across a number of psychometric measures. There were increases in self-compassion, so that was encouraging. But also there were decreases in fears of self-compassion and fears of receiving compassion from others. Together, this suggests that following the CFT program, participants were able to be more compassionate towards themselves and less reluctant to receive compassion from others. There were also statistically significant decreases in shame and self-hating self-criticism. This was particularly pleasing to see, and in fact over 50% of participants showed reliable improvement on both of these outcomes. And we found statistically significant decreases in post-traumatic stress symptoms, with over 50% of participants showing reliable and clinically significant change, meaning a number of people were clinically much better after completing the program. The same was true for depression, anxiety, and stress, all of which showed reliable and clinically significant improvement for this group of participants. In some ways, for me, the most fascinating finding was that a CFT group program was able to help with shame and self-criticism and post-traumatic stress symptoms, despite the CFT group not facilitating any trauma processing. The possible implication here is that some people may be helped with a reduction in post-traumatic stress symptoms to non-clinical levels without specific processing of trauma memories via approaches such as prolonged exposure and so on. Having said that, not all participants in this study improved across the course of the intervention. And so CFT may offer a really great place to start for those who have experienced trauma and are experiencing post-traumatic stress as a result, in line with the phased approach to the treatment of complex trauma and the first phase of stability and stabilisation. All in all, the results were very encouraging. The study had its limitations. We had a small sample size and there was limited cultural diversity, with all but 3 of the participants identifying as Caucasian. And for that matter, there was limited gender diversity, with all participants identifying as female. And of course, the study did not include a control group, nor therefore any randomisation. Nevertheless, this study, led by Dr. Lisa McLean, demonstrated the feasibility of CFT as a treatment for adult female survivors of childhood sexual abuse, including both its acceptability to participants and preliminary evidence of the efficacy of this approach in this group of people, where past traumatic experience can continue to lead to significant suffering into adulthood.